All right, everyone. Welcome to the Pulse of Healthcare. This is Dr. John McCormick. I'm here with my good friend again. We're ready to go today, and this episode we're going to talk about the rising cost of healthcare. That forever upward trend line that we have seen, literally going back to 2015 and before. I mean, there was a point in our history where it looked like healthcare was going to stabilize and, it would kind of rise in conjunction with the normal economic indicators that are out there. So if the economy went up a couple of points, you'd expect your insurance to go up a couple of points. Right, Peter?
Right.
You know?
But now it's at the point where my premiums are going up and I haven't had any claims for a couple of years. I don't understand why all these different fees are getting thrown into it.
Yeah, I mean, it's, when they passed the Affordable Care Act, quote unquote affordable, and promised everybody it was going to drive down costs by $2,500. And what we actually saw in application was rates almost went up instantly, $2,500 more than what they were. And then since then, all we've seen is a steady increase. In fact, there's a couple of reports we've been looking at them. One of those reports comes directly from, hold on a minute, I'm going to pull it up and read it, otherwise I'm going to misquote it, from the Mercer Institute. And they're tracking back to 2015. And what you're seeing is increases, if you were to average them out 5-6 percentage points every single year across the board. Some years are worse, some years are better. I mean, I'm talking to groups right now, they're telling me they're getting double-digit rate increases this year. Now I don't know what double-digit means. Is that 10%? Is that 20%?
Yeah.
One of them told me they were getting a 30% rate increase, and I was like, good grief. All right?
And yet the publications and stuff that I've looked at said healthcare was going up 7%. But when you start adding in not only the premiums and then all of a sudden the copay going up 7% and the deductible.
See, that's a great point, because when we think premiums are going up, that's kind of the highest level, right? My premium went up from $600 to $640 or $650. And you go like, yeah, that's terrible, right? But what they don't say is, well, your premium went up $50, or 5% or 7% or 10%. But we also changed your deductible from $3,000 to $4,000. We also changed your copay from $40 to $50. We also changed your co-insurance from 80-20 to a 70-30 and increased your maximum out of pocket from $7,900 to $11,000. So it's not a one-sided equation. It's not like your premium went up and everything stayed the same. It's your premium went up and, oh, by the way, we also adjusted all these other things as well. So less benefits, more money.
And that's what you spend when you go to the doctor. I mean, it's just, you don't have a choice. You got to pay it.
Well, yeah, except you do, right?
Yeah.
You don't, but you do, right? Because
Right.
you can choose who you do business with, right? And so one of the things that we were talking about, I was talking to an employer, and he's like, well, we pay a whole lot, but our claims exceed what we pay. And I went, yeah, but that's probably because your carrier is paying more than it should for claims, not because of what you're doing. And so that's another peeling back the onion to go, oh, because they say, oh, well, the charges were $300,000 last year or $1 million. In some cases, we're looking at claims, in the millions of dollars, right?
Right.
And then when we put them through the way we do business at Ovation, it's like, well, we would have paid half of that, or less. So, of course, you're paying all these premiums and you think you're getting a good deal because your claims payment exceeds your premiums. But really what you are vested in is a bad plan with a bad plan design that's paying more than it should for the care that you're getting.
The the interesting thing is, from my perspective, as you know, I've gone through the doctor and the medical system, and all of a sudden, not only have all that gone up, the premiums have gone up, the co-pays have gone up, the pharmaceuticals have gone up as well.
Through the roof.
Just without any reason from my simple looking at it, when you add it all together, it's got to be close to a 20% increase.
It really is. It's a cudgel that we're being hammered over the head with, you know, and understandably, people are concerned. They want health care. They need health care. Oftentimes, especially small and medium employers, they can't afford it. I mean, they can't even put it in as a line item budget. And those that do, you know, they have to go, okay, if I'm going to provide this benefit, how much am I going to have to increase the cost of my goods and services to pay for it, right? Which means every year they're going back and saying, oh, my premium went up, which means what I have to charge goes up, which means people buying things from me have to pay more, right? And so here I am in this cost-benefit analysis of what's the most I can charge for something before people go, I can't buy from you anymore. I love you. You've been my business partner for years and years for whatever product, right? And now I can't afford to buy from you. And it's all because you're having to raise your rates for things you don't really control, quote unquote, control. All right?
Yep.
But you do control it, right? You control it with your choices. And so that's kind of what this is about, right? We want to just recognize in this podcast that we know that prices are going up. We also know there's a better way. And we've said multiple times in our podcast, one of our claims to fame is that we've had groups with us since 2018 that have never, ever had a rate increase. All right?
That's amazing.
And here we are coming into 2024. I'm looking at renewals. I'm looking at renewal rates. I'm looking at what's going on across the industry. I'm seeing those 7, 8, 10% rate increases for everybody. And I just sent out 2 renewals today, no rate increase. And for one company, I'm even out from a premium rate lock for 2 years. Nobody's doing that.
You know, what you're saying really comes back to taking the time to put together a program for their employees that fits their lifestyle, their needs, and their budgets, which, you know, the big guys don't do.
Well, and it's absolutely right. It's the partnership between the plan and the employer and the employee and them actually saying, I'm invested in getting good care at the fairest price, and therefore I'm willing to work with you, plan, to make sure that happens, right? I want you to help me coordinate my care. I want you to help me find the best price. I want you to do that because I know if I don't, right, then I'm going to get right back on that merry-go-round that most companies are in where my rates go up every year and I got nothing to say about it. Well, we're telling you do have something to say about it, but you got to make the choice to basically jump off that merry-go-round and say, you know, I'm willing to do something different. I'm committed to, you know, working, you know, with a plan, get my employees working with a plan to get us great care at fair prices where we can pretty much count on rates not going up every year.
Yeah, that's great. And I would invite everybody out there to give us a call so we can help you design a health benefit plan for your company that fits your budgets.
Yeah, and something we don't do very often, you can certainly call us at 866-549-4199, 866-549-4199. Call, say, hey, we're coming up. We got a big rate increase. What can Ovation Health do for us? We would love to talk to you, give you some options, and probably show you a plan that's got better benefits at a better price than anything that you see in the market.
That's great. Thank you.
Thank you. And we'll be back in a couple of weeks with another episode of The Pulse of Healthcare.